This is Richard Semelka. Today I'm going to speak to you about the entity Gadolinium Storage Condition. So to backtrack just for a second to provide an overview of the entities that exist as far as a reaction to gadolinium. And my earliest article in 2016 in the American Journal of Röntgenology, I described gadolinium in humans, a family of disorders. So there are basically four main categories, and there's overlap actually amongst all of them. But these include transient immunologic reaction, which is something I didn't write about in the first report. And that is something that the vast majority of people experience, especially to gadolinium agents that have protein binding. And the principal feelings are warmth throughout the body and an unusual either smell sensation or taste sensation. So that's very common. And almost everybody who gets a protein binding gadolinium contrast agent experiences it, and the majority of other agents also result in that. By its name, it means it's transient. So generally it lasts for less than 10 minutes. So you feel warmth. Some people also describe that they feel like they've peed themselves, but that's a transient phenomenon and goes away. And virtually everybody will experience it. Then there is gadolinium storage condition, which I'll talk about in this report. Gadolinium deposition disease, which is a combination of toxicity and immunogenicity. And when it's negative, and as it is in this case, many authors refer to that as reactogenicity. So it is a combination of toxicity and reactogenicity that different individuals experience different amounts of each of those processes, and they have varying severity. And the category of nephrogenic systemic fibrosis is the category which is, as the name suggests, is a fibrotic process. Probably the best name for it should be in gadolinium-induced systemic fibrosis, GISF. That also I'm not going to talk about in this presentation. And the last entity is acute hypersensitivity reaction, which occurs generally within minutes of getting the gadolinium injection. And that in maybe 1 in 200,000 people can result in death. So of all of them, that's the one that can most quickly result in death, but it's extremely rare. And we generally oftentimes don't mention it because it's so rare. And there is a lot of wisdom to not make patients too frightened at the concept of receiving a gadolinium agent. But again, it has to be measured and thoughtful what we say to individuals. So now returning to the topic that I'm going to speak to you about, which is gadolinium storage condition. It turns out that everyone who receives a gadolinium contrast agent retains some contrast. So if you're not sick from a gadolinium injection, then you have gadolinium storage condition. It so happens, as I've made reference to in earlier blogs and presentations, is that I've received myself 15 gadolinium injections. Most of that was for various research purposes. Well, actually all of it was. And so I received 15 gadolinium injections. So the most recent was maybe now 9 years ago. I still have substantial gadolinium left in my body. To give you an idea of the amounts, and these are my estimates based on extrapolation of all the available animal and human data on the subject of retention of gadolinium. So at 1 year's time, I estimate if you had a macrocyclic agent such as Dotarem, Clariscan, Prohance, approximately 1% of the agent is left in your body. If it's a linear agent that is a non-ionic linear agent, such as Optimark or Omniscan, then the retention is about 2%. And if you have agents somewhere in the middle, like Multihance and Gadovist, as far as stability, they retain approximately 1.5% of the administered dose in your body for each agent at 1 year's time. Now, beyond 1 year's time, the amount that continues to leave your body, and primarily by renal excretion, I estimate to be about 1% of the amount that's left. So 1% of the amount that's left means that you never actually get to zero. So what's remarkable about people with gadolinium storage condition, which is basically everyone who's not sick from gadolinium, which are then the 999 of 1,000 to 9,999 of 10,000, which are the general ranges I use for the development of a gadolinium toxicity, such as gadolinium deposition disease. If you're in the vast majority, if you received a gadolinium injection, you have gadolinium retained in your body. But not to cause you alarm by this, unfortunately, we have retained in our body many different toxins. So all of us have lead in our bodies. Now, the vast majority of us are not sick from the lead, and I would call that lead storage condition. Those of us who are sick from lead, although we call it lead toxicity, probably more accurately should be called lead deposition disease, and so on with the other heavy metals. But everybody has lead in them. So if you're worried about gadolinium, well, you also have a lot of lead in you. And then there's the other heavy metals, mercury amongst the more worrisome and common that we're aware of. But then you have to think of microplastics, PFAs, other forms of toxins that we all have retained in our body. So how much does that amount to? Well, my estimates then are at about 1 year's time, you have the equivalent of 0.1 ml, that's milliliters of the gadolinium left in your body, which is approximately 10 milligrams. So a small fraction of the amount that you received, but it does all add up. So I received 15 gadolinium injections, and so that would be 15 times 0.1, so 1.5 mLs of equivalent of gadolinium I have in my body. Now, I think what is fascinating about this subject and why I like to draw attention to normal individuals is, what are we doing differently in our immune systems that causes us not to react to gadolinium when we learn about, and I also present about, individuals with gadolinium deposition disease who can experience severe symptomatology. What is it in our immune systems and the interrelationship between the immune system and the various cells and organs in our body that protects us from experiencing toxicity? So in brief, my opinion is that our immune systems, in those who have gadolinium storage condition, send off cytokines. And it turns out that you think, well, we're not reacting, so we don't have cytokine release. If we get chelation, which emulates, if you like, the experience of a gadolinium injection, except now gadolinium is leaving your body. But the amount of total cytokine release appears to be related to the number of gadolinium injections, but it's the type of cytokines. So individuals like myself have cytokines that block inflammation. Patients with gadolinium deposition disease have cytokines that promote inflammation, and those with gadolinium-induced systemic fibrosis, they have cytokines that are fibrogenic in nature. Thank you for your attention.